Hi, I'm Becky.
I'm Shao.
I'm Ben.
And we are going to introduce Alzheimer's disease.
Alzheimer's disease is a neurological disorder in which the death of brain cells causes memory loss and cognitive decline. This disease is well known for its recasting effects on millions of older people who lose basic cognitive abilities such as memory and thinking. At first, Alzheimer's disease typically destroys neurons and their connections in parts of the brain involved in memory. It later affects areas in the cerebral cortex, which is responsible for language, reasoning, and social behavior. Brain cells connections and the cells themselves degenerate and die, eventually destroying memory and other important mental functions. The incidence of the disease is higher in women than men. People with Alzheimer's disease develop it after the age of 65, but people under this age can also develop it.
Diagnosis is approached by using multiple tests, the first test being a physical. Questions about your health history, including present and past medical conditions, sexual history, mental state, and family history. Following that, a mini mental state exam and mini cog will be given to test the severity of dementia and how well they memorize names and objects. MRI and CT rules the structural image of the brain that provides additional information to related strokes, tumor, head trauma, and fluid buildup. Diagnosis is divided into mild, moderate, and severe.
Treatments and prescription: physical exercise, aerobic activity for 20 to 30 minutes 5 days a week improves cardiovascular health. The U.S. Food and Drug Administration has approved 2 types of medications. First are the medications for early to moderate stages, cholinesterase inhibitors. Cholinesterase inhibitors are prescribed to treat symptoms related to memory, thinking, language, judgment, and other thought processes. 3 cholinesterase inhibitors are commonly prescribed are donepezil, galantamine, and rivastigmine. Their side effects are loss of appetite and increased frequency of bowel movements. Second are the medications for moderate to severe stages. Memantine. Memantine is prescribed to improve memory, attention, reason, language, and the ability to perform simple tasks. Its side effects are headache, constipation, confusion, and dizziness. Although current medications cannot cure Alzheimer's or stop it from progressing, they may help lessen symptoms such as memory loss and confusion for a limited time.
Some of the symptoms would include mental decline, difficulty thinking and understanding, confusion in the evening hours, delusion, disorientation, forgetfulness, inability to do simple math or inability to recognize common things, aggression, agitation, difficulty with self-care, lack of restraint, wandering and getting lost. So some of them would feel depression, go through hallucinations, or even paranoia.